The international conference for on primary healthcare was held in Alma-Ata of Kazakhstan in 1978. And out of this conference, the countries that were participating in that conference, all of them, they realized and they emphasized that it is primary healthcare that should serve as the foundation for healthcare systems worldwide. Because if you're having a strong primary healthcare, because a primary healthcare is very cheap, it is applied at the population level, it is easy to apply, it is accessible, acceptable. If we can make those things, then the burden on the healthcare system reduces. Okay, so rather than investing a lot on curative services, if we can invest a little bit of that amount into preventive services, maybe we will be able to prevent people from suffering those morbidities. Because even when we are curing diseases, many a times people are ending with lifelong disabilities. Or suppose for disease, for diabetes, hypertension, heart disease, we are only able to control the symptoms. We are not able to make any long term, really we are not able to cure the disease, or we are not able to reverse the pathogenesis of the disease with the medications that we're offering in tertiary care. Okay, so under those things, the focus was on primary healthcare as a foundation for healthcare systems worldwide. So the Alma-Ata conference, the countries, they decided to focus on social equity, nationwide coverage, self-reliance, intersectoral coordination, and community engagement. I'll go into dissection of each of these terms. So can you tell me, what do you mean by social equity? So as you can see, not just India, all of these different countries, they are in various levels of income, they're in various levels of development, they're in various levels of, so not just from country to country, like India is different from England, India is different from Nigeria, like that. But not that if you look at within India also, there are people who are living in the metros who have and earning well. They have very good access to healthcare. There are people in the metros not earning well who have access to healthcare, but it is not affordable for them. And there are people in remote rural areas who neither have access nor have the affordability to gain. Maybe there are rich people in the rural areas also who for whom healthcare is affordable, but it is not accessible. Okay. So like that, so there are many challenges and barriers for people to gain access to healthcare that makes them healthy and makes them disease free. Okay, be it medical care, be it healthcare. So the concept of social equity is that it is like that thing of Hogwarts, that help shall be given to those who deserve. Okay, so if there is a section of the society that is backward, that is not able to access and afford healthcare, then the principle of social equity will channelize more amount of resources towards their access and affordability of healthcare. Okay, and if a section of the society is able to afford, the affluent section, they're able to afford, they're able to access healthcare, then the society will say, okay, if you are able to afford, then maybe you go and you pay and you afford the healthcare there. But for tribal communities, for difficult to reach areas, for people who are being left out by the healthcare system, the principle of social equity is trying to include them. So it is a principle of inclusion that tries to do more for those who are towards the margin and gives a lot of focus to them to bring them into the mainstream and try to address the whole population as a whole. Okay. Next is nationwide coverage. So this is also extension from the principle of social equity, nationwide coverage to ensure that every part of this country, India being a diverse country with different parts of India having different challenges. So nationwide coverage for, if you look at the health programs, for example, if you look at National Vector-Borne Disease Control Program, so the vector-borne diseases in every part, every district are different. Okay, so you have a flagship program, a national vector-borne disease program that looks at, say, malaria, Kala-Azar, filaria, chikungunya, dengue, and Japanese encephalitis. Okay, but while it is trying to do nationwide coverage, so it has focus areas. So the places where vector-borne diseases are more, the funding is more. Some districts have all the diseases, some districts have only one or two diseases. So nationwide coverage to ensure that every part of this country gets a contextual service as per its need. Okay. Most importantly, the third thing is self-reliance. Okay. So we were having this thing from many years that, you will look that UNICEF is coming and funding a particular thing. United Nations Development Program, UNDP is coming and they're funding a particular thing. And out of that, you're having healthcare of the tribal communities. But then that is not sustainable. After a point, maybe UNICEF will go. UNICEF will not have its own funding, or UNICEF's priority will changes. What will happen to this community at that point? So for healthcare to be sustainable, to be able to make its changes over a considerable period of time on a consistent level, self-reliance is most essential. Self-reliance is the ability of a community to take care of its own healthcare needs by the resources that it has on its own, in its own area, under its own governance. Okay, so from that concept only, the idea of involvement of Panchayati Raj institution and communities into the development delivery of primary healthcare comes in. Okay, so we have discussed social equity, we have discussed nationwide coverage, we have spoken about self-reliance. Next is intersectoral coordination. I've already discussed this in detail, that public health is a multi-sectoral activity. A doctor alone cannot do anything. Suppose you want to improve, you want to reduce the burden of waterborne diseases. Okay, so you want to reduce the burden of waterborne diseases, a doctor can only come and treat a waterborne disease. But if you want to ensure that a waterborne disease burden is less, you have to reduce the incidence of waterborne disease. Okay, for that, you have to ensure that safe water is available. So you have to first have a sanitary inspector who goes and looks at what are the areas where sanitary contamination is happening, where maybe from a waste disposal or from a latrine or maybe from a you know where dead animals will be disposed. From there, the runoff is going to the freshwater body from which people drink water. So that has to be stopped. So a sanitary inspector will go and look at what kind of problems are happening in sanitation. Then maybe you require the help of the Ministry of Hydroelectric and Hydropower, or maybe the Ministry of Jal Shakti as we have it. And it is their responsibility to ensure that there is piped water supply. Okay, so and maybe so even after that, maybe so in some places pipe water supply is not available, so they will have submersible pumps. So for that, again, you have to ensure that there is a reliable electric supply for the submersible pump to be able to work. Okay, so all of these things, and then you can have the government which will come in and it will give sponsorships, or it will give subsidies to specific parts of the population to get the submersible pump at a less amount of money. Okay, so there you need the collaboration of the Panchayati Raj institution to label that who is in greatest need of that particular help from the government, so that the principles of social equity are upheld. Okay, so like this, if you are trying to solve a public health problem, it cannot only be done by doctors. It requires the participation of the entire community. Okay, the school teachers, they can help by improving the hand hygiene and the hygiene of children. And children, if they learn good amount of hygiene, they go back to their families and they inculcate those. They make their family members inculcate those principles of good hygiene. So as a result, the maybe you will be able to reduce the burden of waterborne diseases. So like that, if you're trying to address a public health problem, you will have to understand that you're trying to improve the health not of individuals but of communities. So intersectoral coordination is very, very vital. So inter means basically between agents and sectors. So between sector coordination and collaboration, like the other different sectors will have to come together and they have to contribute so that this functions. Okay, and finally the principle of community engagement. So okay, so you might be thinking that okay, waterborne disease is the biggest problem, but maybe to that community something else is the big problem. Maybe to them waterborne diseases are self-limiting, they're not worried about that. Maybe they are worried about why the heart disease is killing so many people. Okay, so only when you engage communities you will understand that what is the public health area where they are attributing a lot of importance to. And unless you are addressing that as well, you will not have their confidence. Okay, so community engagement is very, very essential. So you try and understand that what is the community's area of interest, what is their major concerns, and you try to address that first. And once you gain the confidence of the community, then you try and address the other areas that are your priority areas as well. So that is why community engagement, for things to be sustainable, for people to take the responsibility of health on their own, it is very, very essential that we have community engagement as well. right? So as you know, India as is one of the countries who is a who is a signatory to this Alma-Ata Declaration, and as a result of India's commitment to this providing comprehensive primary health care, we have the Indian Public Health Standards. Okay, so we have the Indian Public Health Standards that lay out the standards. Standard means like what should be the number of primary health centers, what should be the staff that should be there, what is the kind of services that they should be providing, what should be the quality of that service, timing of that service, cost of that service, and all of that. Okay, so it is the Indian Public Health Standards that have been developed. The Indian Public Health Standards last they have been modified as of 2022. So now we have the Indian Public Health Standards of 2022, which guide the delivery of comprehensive primary healthcare in India to its population.